Well, hello.
Hello.
Today, I'm excited to feature one of our incredible partners in the Gracefully Aging Network and with Visiting Angels, CenterWell Senior Primary Care. You're a dedicated healthcare source for adults, focusing on building relationships and personalized care and empowering seniors. So, why don't we just start with you telling us? I already know who you are, but tell everybody else who's listening what your name is and what you do at CenterWell.
So my name is Christy Peltier, and I am a local community engagement professional with CenterWell Senior Primary Care. And my job role really is to provide social engagement for our seniors, creating and executing activities and events, hopefully to provide some somewhat entertainment, but some activities to get them excited to leave their apartments or leave their homes and come out and get social.
So, can you tell me a little bit about how CenterWell, kind of what your model is for seniors?
Yeah. Well, our model of care is value driven. It's not fee for service, which is what we've all grown up in, that fee for service model. Um, but CenterWell, we focus on a holistic approach that prioritizes the overall well being of each individual. We absolutely understand that healthcare extends beyond the doctor's office. Um, we try to address the full spectrum of our patients, their physical, emotional, and social well being.
And how is that different from other primary care options for seniors?
Well, we provide specialized expert care, more or less tailored to their unique needs. We focus on what matters most to their overall health and well being. And because we only see individuals on Medicare, our patients benefit from 50% more face to face time with their provider, reduced wait times in the waiting room, and the convenience of same day or next day appointments for established patients.
I know whenever we do events together, I always am impressed with the fact that you point out you don't have to wait for all the other people in the office to get through, like all the kids and,
Mm-mm.
40-year-olds. It's really just dedicated to
Yep.
seniors, which is really nice.
Yep. They're not competing with the rest of the world to get appointments. We only see individuals on Medicare, so everything is tailored to their needs.
And how does your team help seniors feel empowered and confident in managing their health?
Well, we truly try to make it a partnership where each individual takes an active role in their healthcare journey, yet they're supported by a dedicated team of experienced healthcare professionals collaborating to support their well being and help them feel their best.
So, of course, with my role in Visiting Angels, you and I collaborate a lot on different events and things. I know what my answer would be, but how do you think our home care services complement the work that you guys do at CenterWell?
Well, CenterWell provides comprehensive healthcare services while, in my opinion, Visiting Angels complements this care by offering additional in home support and assistance to meet those the individual's needs. Sorry.
And I mean, I think that with what we do together, obviously events and things like that, that our collaborations really do help provide, some information and some services. So much of what we do is educational, letting them know what is available. It surprises me things that they don't know, you think that they would. But how do you think those collaborations between a primary care and an in-home care agency improve their outcomes?
Well, so CenterWell's mission is to keep seniors happy, healthy, and living independently for as long as possible. And really, this goal is made achievable not only with what CenterWell does in house at the clinic, but also through the valuable support of home care partners like Visiting Angel. We only see them in the clinic. So you add that extra support, an extra pair of eyes, an extra set of hands actually makes this possible.
I agree. I mean, it's we have the same goal. We want them to be safe and happy and living independently as long as they can do those things. And having a primary care physician that they can go to, and, we can take them to if they can't get there. I know you guys do some transportation too to help get them into the clinics. So together, I think it helps just support them all around, even if it's just a little bit of help that they need when they're home, just making sure they're okay. So are there any particular patient stories where, Visiting Angels and CenterWell have kind of come together and made a difference for somebody that you know?
Well, so I don't have anything specific because I'm not on the clinical side. And so I don't have access to those stories. I have reached out to try to, get something more specific, and we're all kind of siloed into, like, once it goes into referral. But I do have I know that just in general, having support from both Centerwell and Visiting Angels just allows the patient to have more hours of direct care for their needs. So, like, Visiting Angels is able to focus more on the non-clinical needs for activities of daily living, and then Centerwell is able to focus on the clinical side. Home care agencies like Visiting Angels, um, you're able to be with the patient for more hours at a time. Unlike, yes, a patient comes into Centerwell and they do have more time with the provider, but our time is still limited.
Yeah.
So that additional support is definitely welcomed by the patients, families, and certainly by us here at Centerwell.
Cool. Well, you are one of like the first people that came on board when I came up with this harebrained idea of doing
Thank you for asking.
of doing the Gracefully Aging Network. And so I'm just, what excites you about being part of that network?
Well, being part of the Gracefully Aging Network, gosh, you're right. We have collaborated a lot, and you have done a masterful job bringing in a diverse group of senior focused organizations. We all bring specialized services directly to the communities we serve. We provide seniors and their families with valuable resources and information, all in one convenient location. And you're right, like, it is surprising that there's so many services that they are unaware of. And even more so that it does seem like we do tend to have to remind them periodically, because they hear us and they don't need us now. And we do like to say at the end of our little one-on-ones that, take the information. You might not need us today, but you might need us tomorrow. So to me, it's just exciting when we sit and we listen to their questions, and when they're unaware of something, but we bring it to their attention, and they just show, like, oh wow, I didn't know this existed. And now we've just enlightened them. We've opened their minds and their eyes to what is available to them.
Yeah. And I think, I mean, it kind of answered the next question that we had anyway, but I feel like that's kind of the best, the big value there is that education piece where you're standing there and you're just telling them, like, here's who we are and here's what we do. And it's kind of surprising when they're like, what? I didn't know that that was an option, or, that there was something available just for a senior. And so it's good to have that. And I think all of our partners in the network have really, come to appreciate the fact that it does give them an opportunity to share about themselves, but more than anything, to make sure that seniors are aware of what's out there, whether it's us that they use or somebody else that does the same thing. At least they know, and they might not have before. So I know you've done several of our 101 events. So what stands out to you about those events and experiences?
Um, well, so I have participated in, uh, not all of them. I know I've had to kind of send in reinforcements a time or two, but what I find different, because we've also participated in those senior expos, right? Where We have a tabling event, and it's also a centralized location where all the seniors can come, and all of the senior resources are in one place. And but with there being so many people, they come in and they just grab stuff off the table, right? And it's a good way to broadly distribute information, but it really does limit direct interaction. Whereas your Gracefully Aging 101 events, it's more intimate. Even if we've had 30, 40, 50 people, it's still a little bit more intimate because we each get a one-on-one period of time where we get to say who we are and what we do, and kind of slow the tempo, and then take questions. And so it really does turn into where it's more personalized communication, where we can answer any and all questions, and at least opening up the beginning of starting that trusting relationship, and always leaving the door open to come back, or giving us a call at a better time. So to me, I find the Gracefully Aging 101s to be far more effective than the senior expos.
Yeah, I think so. I think it's more comfortable for them to be willing to ask a question. And I know, I mean, expos are great because it's a lot of information all in one place, and they all love to come get their tchotchkes off the tables. But
It is a snatch and grab, though. It's a snatch and grab.
yeah, yeah. And I mean, for me, usually I'm the only one at my table. So if they're coming by and they really want to have a conversation, either I have a choice. I'm either trying to talk to this person or trying to handle the five other people that are standing to the side waiting. And so they don't really get, a good response or my full attention. And I feel like I'm kind of, taking away from them when I'm not able to do that. And I love that at our 101s, they can have that. If they want to ask because they're comfortable in front of everybody, they can ask in the group, or if they want to come after and ask one on one, they have that ability to. And, that makes it nice for them, gives them that comfort level. So, from your perspective, why do you think it's important for senior professionals to be part of network groups like ours?
Well, the aging population often requires a range of specialized resources, beginning with maybe a visit to a new doctor, and potentially progressing to home care services. But as their needs evolve, they may require assistance from realtors or senior living communities when living independently becomes challenging. And each of us offer a unique niche service. Like I said, we've done a really, really good job of not duplicating our efforts when it comes to what's available out there. Um, and by working collaboratively, we create like a seamless support system that makes life easier and more comfortable for the seniors throughout their aging journey.
Yeah. I love too that I've learned so much about all of you. So, when we first started this, the very first 101 event, I probably learned as much as the seniors, if not more, because I get to hear over and over at every event what you do, what hospice does, and, the different professionals that are there that represent those different, stages of the journey. Now I'm better educated when I go out because I can say, oh, you need Christy or you need this person because I know from what I've heard. So I love that part of it too. And every once in a while we have a new person or a different service. And so it's fun to kind of have those changes and things like that. So what's on the horizon for CenterWell?
Well, that's a hard question, and we're always expanding. So, even if you might be in Charlotte, we have 5 locations here in Charlotte, one in Gastonia, but maybe you're moving, or maybe you have family members moving. We're forever expanding. So we're not just isolated to Charlotte or even North Carolina. I mean, we've been around for a while, and we are the largest senior focused healthcare organization in the United States. So if you're moving to an area, look to see if we're there and how close we are. Um, we also we do activities and events all over Charlotte, whether it's in our centers or whether it's in the community at a rec center, or what have you. And you can always navigate to find an event on our website, centerwell.com or centerwellprimarycare.com. Find an event and, come check us out. And well, I didn't say this earlier, but none of our events cost our seniors a dime. Um, you don't have to be a patient to enjoy our activities. So, if you are a loved one and you have a loved one that's a senior and you want them to be a little bit more social, maybe get on there and check it out and see um what your family member might enjoy doing.
You guys have tons of stuff. I love that you guys do so much. I mean, I know your crazy schedule as always, but it's really cool. Like, I just feel like there's a little bit of something for everybody. And I love that I see them all the time because I'll have some of them come up and they'll have been at, the senior center, and then I see them at your events, and so it's cute that they're out and about and actually.
And believe it or not, because we have almost been like ground zero for some of their friendships.
Yeah.
There are little groups that have come together because of coming to our activities and events. They've gone shopping together, they've traveled together, and it's nice to see. And we know that they met because of us. They met because they left their house, they came to a CenterWell, whether it was to play bingo, whether it was a lunch and learn, or whether it was our comedy show. They had a good time, they've met some friends, and now they're engaging that social aspect of their life.
Which is so cool. So, how do you see your partnership with Visiting Angels and your involvement in the Gracefully Aging Network growing in the future?
Oh gosh. I would love to see the Gracefully Aging Network to become the premier resource that communities turn to for reliable senior support and information. I know that again the senior expos are like, hey, let's get a bunch of people in, but I'd really like for communities really to reach out for the premier senior resource group.
Yes, you and me both. I had somebody ask me the other day, like, where do you see this in 5 years or 10 years? And I'm like, I don't know. I hadn't really thought about it at the time. I mean, I just, I did this because I needed it to organize all the chaos that I was creating on my own. But I would too. I would love for the name to be known, for people to be like, oh, well, if you want to know what's happening or senior events or resources, go to Gracefully Aging. You can find it all. And, us as a community of senior professionals just continue to support each other. Because for me, that's been huge. I mean, you guys are always so gracious and caring and supportive of my random ideas.
Great random ideas.
Like, everybody contributes to my insanity. It's perfect. So how can seniors find you, Centerwell, events that you're hosting, all that good stuff?
Well, I kind of mentioned it earlier. There's CenterWellPrimaryCare.com. There's three little, I guess, the hamburger menu up there at the top right hand corner. You click on that, you can find a location near you if you happen to be looking for a new provider. There's also a find an event tab, so you click on that and you just put in your zip code and it should pop up all of the events in and around the Charlotte area. And you don't should not feel like, oh, well, I live in Matthews, I can't go to West Charlotte, or I can't go visit university. You can go wherever you want to go.
Cool. And you guys also have, I don't think we've talked about it, but y'all have home health, which is great. So I think that's important for people to know too. It's not just primary care, but you have a home health side as well. And
The pharmacy. We do have,
pharmacy. Yeah.
yep, there are three companies under the CenterWell umbrella. We have CenterWell Pharmacy, CenterWell Home Health, and CenterWell Primary Care. I do like to point out that the home health is different from home care, and it gets a little confusing when people not understanding the intricacies of what's home care and what home health is. But home health is medical. So if you're coming out of rehab, out of the hospital, you need wound care, occupational therapy, physical therapy. It does require a referral from your provider, which is different from, the home care services like Visiting Angels. So,
Yeah. I
not,
usually tell people if the doctor said we're going to order home health,
uh-huh,
that is
right,
not me.
right.
Not
Ah,
me. We
but
can,
it confused.
it
It's,
does. It's
mm-hmm.
very, very close in nature. So just one side and the other. But yeah, I love that you guys do so much too. And you've been amazing. I always love collaborating with you on anything that you're doing. The comedy show was awesome. I was really
Thank
impressed.
you.
So
Just wait
uh,
till next. Just wait till next year.
bigger and better every time, right?
Bigger and better. Yes.
Well, and we've also started listing some of y'all's events on the Gracefully Aging 101 site. So that's going to be helpful too. Just another way for people to hopefully find it. If they don't make it to CenterWell, they can make it there and then get to CenterWell through there. So
Thank you.
cool. Well, thank you.
Yes, ma'am.